Greetings from Canada. I'm Dr. Greg Anderson, and I'm going to be talking about building a resilient ecosystem supporting public safety professionals. This work was funded by the Canadian Institutes for Health Research. I have co-investigators. I've been working with 6 partner organizations, and I have a breadth of students working on this project with me. What we have noticed over the past working with these populations is that we bring them in healthy, and over a course of a career, they move towards ill health through reacting, having signs and symptoms of mental health problems, all the way through to then having met the clinical diagnostic measures for specific things like post-traumatic stress injury, depression, anxiety, social anxiety, etc. So if we want to help these organizations, we need to try and reach upstream and give them the skills that they need to stay healthy over their career. And that really is the objective of this work that I'm going to present today. Because what we've been looking at through our research is what is the impact of stress on these occupations from a performance perspective and a psychological perspective, and what are the types of stressors and the trauma exposures that they have. And what we know is that repeated cumulative stress can lead to moral injury, chronic pain, depression, anxiety, and substance abuse, eventually putting them into the bucket of post-traumatic stress injury and post-traumatic stress disorder. So about 20 to 30% of all of these individuals in Canada we have 9,000, we surveyed over 9,000, about 30% of them would have met the diagnostic criteria for post-traumatic stress disorder, about 20% for anxiety and depression. So our goal was trying to reach upstream to develop resilient skills that can be deployed prior to events leading to stress injury. So what we're really hoping to do was create a psychologically safe workplace and a resilience ecosystem encompassing the individual, their families, and the workplace, those places where they interact in order to gain their strength and have them help them with their stress and work. So understanding resilience, we look at resilience as a human experience that defies the assumption that stress, loss, and trauma inevitably incite distress and dysfunction. So essentially, the ability to rise above traumatic and ambiguous losses by not letting them immobilize you and living well despite them. It's gone through a number of transitions. Resistance was the first. Originally, it was how did people resist becoming ill in certain situations? So they looked at that resistive factor or this ability to be invulnerable to that particular stressor. Then they looked at recovering and returning to the pre-state once they were exposed to a stressor or traumatic event. And now we really look at it as recovering, but going beyond recovering and building new skills and strengths that will allow you to overcome that challenge in the future with less of a stress response. So we used a definition that is essentially the ability to engage in adaptive behaviors in the face of stress, trauma, adversity, and threat. So the adaptive behaviors are protecting them from the stress and trauma and adversity or threat, and allowing them to stay healthier and well. So by looking at an individual and the workplace and the family where that individual interacts, we looked at Bronfenbrenner's ecological theory and applied the ecological theory and model to our work. This was recommended a long time ago with the World Health Organization in the 70s, saying there had to be a holistic approach in mental health promotion and intervention. And that lens really allows us to bring the 3 things, the individual, the social and societal factors, and their interactions into our work. The ecological perspective offers a way to simultaneously emphasize both individual and contextual systems and the interdependent relationships between these two systems. This is based on our prior research in stress, and we looked at whether we could modify stress reactivity upon a stress. Part of it comes from an individual, and this would be training. What is your cognitive appraisal? So if you think that it's a challenge you can overcome, you can not have the same reaction as if you think it's a threat. If you employ some coping strategies, again, in that individual bucket, these could be breathing techniques or other coping strategies that can be immediately deployed or deployed immediately after the stressor. And then we have a bucket which includes the family and the work and how they support the individual to be healthy and well and return to work and be productive. So in ours, we essentially applied the ecological theory and looked at individual, workplace, and family and their interactions and tried to create organizations that embraced supporting all three to allow individuals to thrive within the workplace and be resilient and avoid the path to mental health issues. So our work essentially looked at implementing the Canadian psychological standard, and then looking at psychoeducation of the employees that allowed them to develop a common language and skill sets that they could talk about and utilize in their work. There were both individual, how do you interact with your family, and how do you interact with your workplace in a healthy way. The Canadian Psychological Standard, the intent of the standard is to enhance workers' psychological health by mitigating psychological harm due to workplace factors. They identified 13 psychological risk factors that affect the psychological health and safety of the workplace. When we work with public safety professionals, we add 2 others, chronic stressors and also cumulative traumatic exposure or exposure to stressful events. We evaluated those up front and looked at where the organizations wanted to put some of their efforts into creating a resilient ecosystem inside their organization. We developed courses, the psychoeducation piece, for them and delivered them to their employees online. We started each one of our courses by looking at doing some sort of systematic review with meta-analysis if the data allowed it. And in the individual bucket, we really found that multimodal, so a mix of mindfulness, psychoeducation, resilience, promotion, stress management, a mix of that had the best effects. And it had modest time-limited reductions in symptoms of depression, burnout, stress, post-traumatic stress disorder, and anxiety. So we built the course based on that information and looked at the education piece around what is stress, what is resilience, how do you manage your stress, how can you develop coping strategies to increase your resistance to moving down a path towards illness, and how do we help protect the individual by giving them skills to either work within that particular environment at that particular time or immediately after. So one of the things that we got them to do was look at how they recognize stress in themselves and how they recognize stress in their coworkers. Typically, you would see recognizing stress in yourself through the physical signs and symptoms, heart rate, perspiration, the breathing rates going up, whereas what they typically would find is when you recognized it in another, it might be that they were sharp and short with you. It may be that they didn't have the same problem-solving capacities at work. It may be that they came and they were less engaged and exhibited behavioral symptoms. So there was a difference between how you recognized it in one and the other, but you need to have a suite of ways to recognize when you're stressed and you need help, and when your coworker is stressed and they may need help. And that was part of the course. The other part of the course was giving them the skill sets that they needed to cope. And so we talked about various forms of coping strategies and what some of those strategies, how they could employ them and what that might look like. And then we taught them some physical types of skills that they could use during and after a traumatic exposure, such as 4-square breathing, where we're trying to activate the parasympathetic nervous system and bring them back towards rest. Within the family resilience, again, we started with our overview and our literature search. We supported the model that had been developed by Walsh previously, but we added a bucket into that where it was public perceptions of roles. So, for example, in North America right now, the role of the police and an anti-blue movement where people are questioning police, especially in the United States, but it's also moved into Canada now. So that when your children are in school and they know that your dad's a police officer, how does that impact the child, that type of thing. So we're looking at the impact of family and more at the public perceptions and the roles on top of what was known before. And we also look at PSP and lifestyle factors that are going to impact them, because there's structural interference due to their work. For example, the non-standard work schedules, the overtime that they may encounter that doesn't allow them to create routines, and the role overload that they have maybe at work. There's emotional interference because they bring stress home and the tension's over, so there's crossover in between work and family. When you get home from one of those really stressful events, you may not be able to engage with your children or your wife in the same way. And then there's this identity around how they perceive themselves. And you know, police officers really do identify as a police officer, and that's part of their identity. And then you have to recognize that there's a risk of injury. And so when the individual goes to work, the family has that laying in the background, and how does that impact the family? So we looked at trying to create a suite of activities for PSP families where they can engage children at different ages and spouses and other individuals. And you know, for example, if you were looking at creating some cohesion around family values, you could use something like, if we gave you $1 million today, how would you distribute it to charity? You can't keep a penny. And then look at how people thought of, because maybe if you had an elderly parent, it may point you in the direction of, we're going to donate it to elder care and look at the supports that are required for elderly. Whereas people, but anyway, this is a family cohesion activity. So do you and your children and the others around you have similar types of values that would drive that donation? It's just one example of an activity that they could be doing. We then looked at developing workplace resilience. In workplace resilience, we have two really big buckets of things that we're trying to accomplish. One is, what are those things that allow you to increase the psychological safety within the workplace? And then the other one is a positive workplace environment and cultural shift. And so if we stay there, we're talking about work engagement, workplace teams and how they function, and the culture within the organization and how they create supports for employees in the workplace. If we looked at the psychological safety, this is how do you apply conflict resolution? How do you mitigate bullying and harassment? How do you ensure that ethics and integrity are at the forefront daily, etc.? So we were looking at how do we build skills and knowledge that allow them to function in a resilient workplace, and a workplace that had a culture that really fostered a resilient employee. We did exercises within this particular module, thinking exercises, activities. We also had a series of activities that they did based on scenarios and responding to the questions within scenarios. They could do this as a group or as an individual. And I think the big thing of this is why. So essentially we wanted to change the career trajectory to illness to keep them well when they retire. So why would one of our organizations invest in this? And this is really getting at what was the return on their investment. And we don't have any answers yet, and there's very little information on return on investment on these programs. It's usually more wellness programs in an industrial environment that you'll find, and in there it's everything from like 50 cents to $25. When you start to look at the occupations within public safety realms and frontline healthcare, there is some indication that there's a return on investment. What we know is that we can shift an individual's resilience, for example, with our resilience course, and that any training is better than no training, but you have to make sure that you're implementing something which is targeting the outcome that you want. So if in Canada, using the mental health first aid model, increased knowledge, and the road to mental readiness increased or reduced stigma. So they had a very specific purpose, and one thing isn't going to address all of the factors. The other thing that we know is that there is rapid skill decay. So if organizations implement something once so that they can tick a box and say, yep, we trained them, we know that that skill is going to rapidly disappear over the first 30 days. There's a couple factors there. One is, how can we give little snippets after that to maintain their knowledge and ability? So could we invest in some updates or even email messages to them to make them think about those skills? Or number of times that they're trained, because the people that are trained 5 or 6 times had way slower skill decay than those that were only trained once. So repeated training becomes something that we're going to have to invest in. And if we do it right, we know that we can have an impact. And it's anywhere from 2 to 6 to 1 return on an investment, depending on what groups you're looking at. Most of this comes out of healthcare environments. It's the closest we could come to the public safety profession realm. And if you looked at online delivery, there's the one study that looked at a digital platform that provided content, so psychoeducation and access to treatment during COVID. And they found that across all levels in the organization, there was a positive return on investment. So just to go back to this, my whole idea in developing this stream of research was to not stay in the treatment model that gets them back to where they were, but to really try and implement a model that allows an individual to be resilient and not get to the illness state, and to try and help them throughout their career stay in that healthy area upstream. And so if we invest in that upstream environment, hopefully we can reduce the number of people that move into illness, require treatment, early retirement, death, etc., and have a better economic impact on our organizations through some mitigating work rather than reactive work. And still to know, how this works. Most of the research in North America is really based on a treatment model, and in this space, very little research has moved upstream in a meaningful way to try and increase knowledge, awareness, workplace culture, and creating an environment where people can thrive in a psychologically safe workplace and allow them to excel through interacting with the whole ecological framework which they're going to work in. For example, the spouse is probably going to be the first one to recognize that they're in trouble, but they don't have the training or the skill set to respond. So these are the types of things that we're trying to do as we work upstream and trying to reduce the impacts of the repeated exposure to trauma and stress. So again, we're trying to stay in a wellness paradigm instead of a treatment paradigm to keep people healthy. We're trying to keep people above that breaking point throughout their careers. Our work can be found on a website, publicsafetyresilience.trubox.ca, 3 pillars of resilience. We have some knowledge mobilization papers there. So there's 5 in open access government, and there's 1 in Scientifica that are easy reads for people to understand what we're trying to achieve and some of the results that we're having. And if you want more information, you can find it on my researchgate.net profile. I'm Gregory Anderson-7. I hope it stimulates some ideas in you on the value of working beyond the individual, engaging workplace and the family, and solutions to the mental health crisis within these workers. Thank you for your time.